4118. Yes.
John, that Madison, 4,482, can you explain that column?
Yes, what that is, that's part of our anticipated income. There's two types of anticipated income that we count on. One is the interlocal contracts and the total of that. And the other, PHPF, stands for Public Health Priority Funding, which is a state grant
Okay.
that we've been getting each year. And that offsets the cost for each one of our communities. It offsets Madison's cost by $44.82, which isn't much, but it's something.
Okay.
And we have to address that.
And the revenue on this page will not include all those items that are being generated by the health department. This $4,000 only.
This is just anticipated income. The other unanticipated income that we generate during the year in the way
Right.
of fees or Medicare reimbursements, that is unanticipated income. We don't know what that level, the level is going to be, so it can't really offset the budget.
It varies every year, really.
Right. Thank you.
But it is considerable. It tickles $100,000 each year.
Thank you.
Let the record reflect that Mr. Elias has arrived.
All important record.
For the council's benefit, that the revenue that we're discussing, when it comes in, it's classified as miscellaneous revenue not anticipated. It goes immediately to surplus.
Okay, so it's not actually part of this.
That is
account
correct.
that we're looking
That
at.
is correct.
Okay.
And how much did you say it was in the past that has come in?
The miscellaneous, it varies depending on how many people come for flu shots, because we get reimbursed by Medicare for that activity. It's very often around $100,000.
$100,000.
Between 75, 100, sometimes over
Okay.
100.
Thanks.
Let me get that number. I think it's less than that, but let me get that number.
About 117,000.
117?
Yeah.
Just followed your lead.
I should have brought the computation I had at home.
Unfortunately for the health department, it doesn't get reflected in their budget.
There was something that was
Yeah.
added at the end. Damn it, I should have brought it.
John, you need to look at the two versions. You're not looking at the right thing. What?
Where did it come from?
It was here.
Oh.
I don't know why yours isn't there.
Okay.
I have another question, John.
Yes.
Regarding professional services,
And where did that come from?
you spent $33,000 in 2008.
Yes.
And you're reducing that to $26,000 for 2009. Could you explain the reduction?
Some of that is clinic and lab costs. If you have a reduction in what it is per lab cost, you have a reduction in your total. You have fewer people availing themselves of these services at times. You can reduce it. That sort of goes along with physician services. We also have, I try to get the Board of Health to entertain a $5,000 participation in the governmental public health partnership, which is something that
Okay.
and that was excluded. So it all adds up.
Okay, one of the items that I noticed is the attorney fees. That
Yes.
is lower than the
Yes.
contracted rate. How are you going to cover
Well,
the cost?
The contract, I believe, stipulates there's a ceiling. That contract doesn't stipulate a certain amount that the attorney will receive. But the reduction will be a result in the attorney not going to court anymore. The Board of Health attorney cannot act as a prosecutor anymore. So that would be a great deal of savings.
And we've also anticipated that the attorney will not have to attend each and every meeting we're going to have him present when legalities are involved, so he can help us with those. But we don't anticipate him being there for every meeting.
Also, another question related to that. Hope that you remember that last year, I was the council liaison
Yes.
to the Board of Health.
Right.
And I thought last year, at some point, that the board decided that the board was going to pick up the labor attorney's fee rather than having the borough pay for that portion of the expense.
Right.
So that's no longer the case here?
No, it's my understanding that the borough did pick up that attorney's fees for Mr.
Right.
Jacoby
Right.
in the legalities that he supplied for us. But I don't recall that we were going to pick them up as a board expense, as
Okay.
a Board of
So
Health.
we will continue to pick up the labor attorney
Well,
fee?
we did pay for 2008. Our goal is, Peter King, who's now been hired, has a background that the other prior attorney did not have in labor.
Yes.
So our goal is to
Exclude you completely.
try to exclude ourselves from the process. There is adequate funding in the event of an emergent matter where there's a conflict. We could fill in, but our primary goal is to reduce the legal fees overall by having
Right.
non-attendance and the municipal prosecutor handle the affairs. There's a new advisory ruling saying that the Board of Health attorney can no longer prosecute health-related enforcement actions in municipal court. The municipal prosecutor has to do it. So his contract was upgraded about $1,800 to cover
To
those
cover-
enforcement
Great,
actions.
okay.
So in fact, we are helping, but we should overall reduce all our costs for legal.
That's right, that's right. So there is no shift of costs from the borough over to
No,
the
neither
Board
way.
of
Nope,
Health?
nope. No, the board's
Okay,
done a good job.
We can't stand another cost.
okay. Robert, you were getting some numbers for us, or not?
Yes. What we're reporting here, which are the audited results, the numbers that I'm reporting here for the miscellaneous revenues,
Yes.
it was $68,416 in 2007.
I didn't bring the sheet with
Okay.
me, but I can verify that figure.
All right, and then for 2008, we're reporting $48,749.
Now, there was $14,000 that was collected in 2009, but it was attributed to the 2008 year. But they did pick that up in 2009. So if it's 14,000, that brings it to what, 70, 80? But there were other savings in there, and I do have the itemized sheet at home. I should have brought that.
Please, let's
I can make that
bring it to the
available.
light.
Huh? I ran home with the rest of it, but I can make that available
Bring it
to
to
you.
the
Huh?
Put it
Bring
in
it to the light.
plastic.
So do we have any other questions, discussions?
I have an observation that perhaps could be clarified. I think there was a discussion at your recent board meeting about the role of and the importance of shared service contracts, and there seemed to be a divergence of a position. Maybe it would be helpful if the council shared their thoughts. Our general philosophy is shared services contracts are important. In fact, today, with John's help, we actually identified 4 additional towns that we're pursuing for contracts, and I guess there was a
Future contract.
future contracts, and I guess there was some divergence of positions. I think it's important to hear from the governing body as our...
There is a study that we're hoping to do to see the point of diminishing returns. And we haven't executed that. There's been so much more to what we had to accomplish that Bill, who has suggested that there is a point where adding more may be diminishing in the returns that we do get. And I would like very much to see that. I'm sure there are other availabilities out there of towns that we might be able to service, but I would like to know that it's going to be to our benefit to do such a thing.